Good afternoon, everyone. This is Dr. Martin. I am absolutely thrilled to be here with an incredible CEO, leader, and co-founder of an absolutely terrific company that is dedicated, mission-driven to helping patients in particular, but also healthcare providers with the economic stresses that are embedded in our healthcare system, which have been growing over the years and are worsening. So first, before we get started, I want to thank everyone for participating in our weekly webinar series. It's just been an absolute delight to bring incredible leaders to the community that we're building. I don't want to thank everyone for signing in today. I want to make sure that everyone understands that this is an interactive webinar. We will answer questions. If we can't do it today, we certainly will circle back within the next week. We encourage everyone to let us know where they're calling in or dialing in from. We do have an international community. We already have Martin from Norway. We've got Chad from Dallas. We've got Kate from Iowa. It really speaks to the ubiquitous need for better and better understanding of what the possibilities are to work together as community members, from healthcare providers to scientists to engineers to entrepreneurs to corporations to universities, to come together to solve a global problem. And today, you're going to hear from Rachel Mertzenmeyer, who is a co-founder of an incredible company. And what we're going to talk about today is the beginning of an incredible trend. The beginning means that we're looking at different cohorts of patients within the United States, but that's just the start of a potential global outreach, which recognizes that it's very important to help people in need. And particularly as we are in an economic crisis, Rachel will explain to you her research, which looks at the increasing costs, which are accelerating recession after recession, and how technology and entrepreneurs are helping solve some of these problems, or at the very least, reduce some of the stress to mitigate the damages. I would like us to begin by Rachel explaining to her about her vision and her mission. She is the co-founder of RIVIA Health. She has passion, she has grit, she has a clear vision of where she wants this company to go, and Endeavor is a strong supporter. So Rachel, thank you so much for coming here today to tell us about what you see as an urgent need for your company to help patients solve some of their economic problems.
Absolutely. Thank you for having me here today.
Why don't you begin by telling us a little bit about yourself and your co-founder, and about how you started this journey, what you see as an important role that you and your co-founder are playing.
Yeah, absolutely. So I met my co-founder, Elizabeth, first when we originally were pivoting the company into a new model. And Elizabeth is incredible. She has over 15 years of experience, specifically in healthcare revenue cycle, very in-depth knowledge in terms of bringing the product development insights to provider organizations and making an impact with product development and innovation. And she started her career at Epic. She then worked at Experian Healthcare, working on patient engagement tools and revenue cycle tools. And then she worked at Surgical Information Systems as well, building revenue cycle tools prior to joining us. So she's been a fantastic partner. And originally, Elizabeth joined as the VP of product, but she was such an incredible partner working with me side by side that after 1 year of working together, I asked her if she would be my co-founder and COO, and she said yes. So I went from being a founder of one to a co-founder and have a really fantastic partner. So that's how Elizabeth and I met in our story. I originally founded the company, though, from a personal experience that I had with medical billing, where I was working in a Fortune 100 company, Unilever at the time, in brand management. And I had a really severe injury that led to 38 medical bills across 11 different healthcare provider organizations and over $10,000 in personal out-of-pocket costs that I had to manage. And through that experience, I really learned firsthand all of the pain points and barriers to payment that patients experience. And through that, feeling the pain of, for example, having to understand what the bill meant and what I owed versus what insurance paid, and sorting through 38 bills and finding 15 duplicate bills in addition to that, and sorting through trying to pay the bills across 12 different portals and waiting on the phone for 30 minutes to pay, only to learn that you'd been sent to the wrong department, right? So all of those pain points of understanding the bill, getting visibility to the bill, and also getting visibility to payment plan options, importantly. So 80% of provider organizations offer zero interest, credit risk-free payment plan options for patients, but most patients aren't aware of that. And so they end up being sent to collections or actually having collections agencies pursue them, which can lead to bankruptcy. So in fact, 14% of Americans have been sent to collections for a bill that they were never aware of in the first place. So awareness is actually one of the key issues that can lead to patients being sent to collections that we're working to address. And in fact, when you dig into the data a little bit more, the number one reason why patients who can afford to pay their medical bill, which is 75% of patients, the reason they don't pay, number one reason is that they weren't aware of it in the first place, which ties to the reason why they're being sent to collections, right? So really the first step that RIVIA Health is looking to address is making sure that we're communicating to patients through modern communications like text and email, and doing that on a more frequent basis than your standard 30, 60, 90-day process that we've been following in the industry. And so that awareness is really the first piece. And then the payment plan options, really making sure that patients know that those are available to them, that they don't have to use their credit cards and go into a lot of credit card debt or be sent to a collections agency, but they can start making payments in small increments from day one. Usually what happens is provider organizations will wait until day 90, right before a patient is sent to collections, to communicate about payment plan options. And our research shows that patients are willing to pay. Most of the time they can afford to pay if you give them that option to pay in installments. So we really, our software is driven to automatically recognize when a claim qualifies for a safe payment plan option, and then make that available to patients upfront from day one. So those are a few of the pain points that I uncovered as a patient. There's also, of course, the convenience factor, right? And also the fear of medical bills that patients experience, where they're already overwhelmed by the injury or the sickness that they're dealing with, the illness. And then on top of that, they're dealing with medical bill overwhelm, right? And with all of the different portals requiring different account creation, account login, different payment processes, some providers still require a check in the mail. Some require you to wait on the phone during work hours to pay your bill, and it can become a lot to manage. So with RIVIA Health, the other key factor that we're focusing on is making it easier for patients to pay their bills. by simply clicking on a link and paying in 45 seconds or less with no account creation, no password to remember, but still fully secure. So those are some of the key elements. Of course, one more thing I'll mention that we've identified is that confusion is a key factor. So, patients in America especially will get medical bills, and they're often very difficult to understand in terms of what they owe, why they owe it. Oftentimes, patients will think that they've already made a payment and that they don't owe anything else, but there's a remaining balance later that they are sent. So RIVIA Health also helps to enhance the level of understanding for patients so that they understand why they owe what they owe, what they've paid before, and how that relates to what's still outstanding.
Yeah.
So those are the, yeah.
One of the things that I want to highlight is the fact that you are developing a social awareness, a social impact program, because as you pointed out to me off camera, each recession is followed by more and more pain in the healthcare payment system.
Yeah.
So the cost of healthcare is going up, despite the fact that technology is a productivity enhancement tool, because more and more drugs are increasingly expensive. There's more out-of-pocket costs.
Mm-hmm.
This burden is being carried disproportionately by disenfranchised communities.
Yes.
So one of the things that RIVIA is focusing in on is how do we address this healthcare disparity, both in the U.S. and outside of the U.S. And there are companies that I actually am involved with called Outpost, which is a company that's looking at developing payment systems within the African communities, particularly in Nigeria. And RIVIA is looking for ways to address the pain points within these cohorts. So I'd love for you to talk about that mission, the vision that you see, because ultimately technology needs to be used to drop the cost of healthcare. It is being used in different companies like In Silico, which has brought a drug to market in 30 months instead of the typical 12 and a half years. There are other electronic and digital platforms that are improving patient and physician interaction. There are a host of number of other tools like biomarkers, which are improving our ability to detect disease earlier, and health and wellness programs. So all of these pressures are being put on reducing cost. And one of the things that you're adding on to this is awareness. So this awareness that, there are problems, but there are solutions. I'd love for you to talk a little bit about that.
Yeah, absolutely. So we are a mission-driven company. We actually started originally as a direct-to-consumer solution, and we have pivoted since then to be a B2B SaaS, and our customer is the physician group organization, but we've never lost our passion and commitment to supporting patients and solving the problem for patients that they face. And in fact, to your point, Dr. Martin, over the last 3 recessions in the US, healthcare spending has increased significantly. So we expect that trend to continue. And already for years, medical debt has been the #1 cause of bankruptcy in the United States, representing about 61% of bankruptcy in the United States. And, you may think that that only impacts the uninsured, but over 70% of patients who end up filing bankruptcy due to medical bills had insurance coverage. So really, it's important that we unlock and uncover what's going on here. And healthcare spending overall for patients, healthcare costs, that burden you were talking about of the out-of-pocket cost has increased by 88% in just 5 years. So whereas 10 years ago, only 2% of any given medical bill was a patient responsibility, now that's 15% on average across the US. And that's only increasing over time. And so, that's of course creating a ripple effect where it's creating pain points and bankruptcy for patients. It also causes patients not to get the care that they need. So over 30% of patients who feel like they can't afford their healthcare costs stop getting care. And so that, of course, just aggravates the problem and makes it worse. And then all of these issues that patients are facing also turn into a real pain point for the provider organization as well, unnecessarily, where providers are spending 56 cents of every dollar that they're trying to collect, attempting to collect the patient balance. And it's taking them over 60 days on average to get paid by patients. So there are really these pain points on both sides that technology can come in and solve. And so apart from building the technology that can help alleviate these problems, RIVIA Health is also launching a social responsibility program where we're going to be participating in solving the solution from a mission standpoint firsthand as well. And we're still figuring out the details of that, but really our intention is to develop a matching program over time where patients and providers can choose to contribute and round up their payments so that we can match that and then donate that to organizations like RIP Medical Debt that alleviate medical debt for people in need and help avoid them from becoming that statistic of being sent to bankruptcy. And then I'll just say one more thing on this point that, Dr. Martin, as you pointed out, disenfranchised people are really impacted the most by this problem. And that the data demonstrates that. So women are impacted more significantly. They're more likely to be sent to collections for medical billing. They're more likely to go into bankruptcy from healthcare costs. And women engage more with healthcare across their lifetime. So even from just the emotional and psychological burden of managing healthcare finances, that falls on women more than men, not only because we're engaging with healthcare more ourselves, but because we tend to statistically also be managing our parents' bills, our children's bills, and the family's bills as a whole. So we've also looked at partnering with companies like MISRA as well that are helping to impact the social impact for women by enabling them to get options for using their FSA and HSA in a safe manner and get better financing options to finance their healthcare as well.
There's so many organizations in such powerful positions, and I'm happy to make those introductions to you, both for helping disenfranchised communities here in the U.S., but also stepping outside to other countries where there is just a tremendous problem. So one of the incredible, let's say, economic innovations over the past 20 years has been microfinance. And microfinance has been a way to empower women who typically are incredibly responsible in terms of the finances for the family. And microfinance has been part of a Muhammad Yunus program, which was started several decades ago, to give small amounts of money to people to help with financing of various economic burdens, and healthcare certainly is one of them. I think that Citibank has taken a real lead in this process, and I think that one of the organizations that would be terrific for you to get involved with are some of these microfinance organizations, which can help various communities. I don't know if we've lost you there, Rachel, but I don't see your video at the moment.
I'm here. Can you hear me?
Now I can see you.
You can see me now?
Okay. Yes. So terrific that you are recognizing the fact that there are these different cohorts, and I'm more than happy, and Endeavor has been part of the Global Fund to fight HIV, AIDS, TB, the Clinton Foundation, the Gates Organization, Rockefeller Foundation, Acumen Fund. The list is fairly long in terms of social impact. And I think that my interest, and certainly the interest of Endeavor, is being able to support great women leaders and entrepreneurs like yourself and Elizabeth, who are mission driven and bring perhaps to the table some things that aren't necessarily in your field of view currently. And so I'm happy to work with you, off camera, on the sidelines, to be able to introduce you to these leaders who look at what you're doing in a very, I think, benevolent light, because, as you say, women typically throughout the world are much more responsible in terms of finances. They are generally the family leaders, and they generally are responsible for multiple people within the family. We haven't even talked about the problems with pediatric care or other subspecialties. There are a host of organizations now that are looking at these problems. So we do recognize companies like 30 Madison, which is an incredible specialty healthcare provider that looks at specialty diseases which have exorbitant bills associated with them and finding ways to minimize those costs. And of course, Kindbody, a company that we highlighted in our October symposium with Harvard Business School and Capgemini. Again, a leader in women's healthcare, looking at dropping the cost of in vitro fertilization and women's healthcare to reasonable levels. So those are the kind of companies it would be my pleasure to introduce you to, because I think what you're doing, cuts across so many areas. And I would say it's a touchy subject to talk about billing and finance. So it's courageous for you actually to come on and talk, to this audience about that, because, the focus really is, how do we provide new drugs? How do we provide new medical devices? But embedded in all this is, how do we deal with the costs? So there are companies that are looking very, very closely at value-driven healthcare, but the billing aspect of it and how to deal with the day-to-day stress, the psychological, the emotional stress that people feel in knowing that they have a burden which is chronic. I mean, that's something that you and your colleague are addressing, and I applaud you for that.
Thank you. Yes, that's so true regarding the emotional burden. In fact, when I started the company, I interviewed over 200 patients just to really hear their stories and understand what their pain points were. And a theme that came up was a fear of medical bills, where patients would describe their experience with medical bills in very severe language. In fact, I had several cancer patients that compared medical bills to the fear of death that they felt. And they would say that their number one fear was death, and their second fear was the medical debt that they were facing. And that just really broke my heart, because patients that are facing such difficulties in their life really shouldn't have to have that burden, that financial burden placed on top of them as well, and on their families. So I completely agree with you that that's really kind of the hidden cost that exists amongst patients.
In most other developed countries, there is healthcare insurance systems in place which do afford greater patient empathy, greater patient awareness and sensitivity. Switzerland has been used as a model by healthcare economists for many years, to look at that. But even these systems have failings. And so I do think that being able to use technology and mission-driven entrepreneurs who focus on using technology to make the system more effective and efficient and productive, will only make things better for patients. As we move forward, and as things like VR and AI begin to embed themselves into drug development, into the service sector, the cost of healthcare should come down. The big problem, though, is that there is one variable which is now probably the number one problem within the healthcare system, which is the supply-demand of provider imbalance. So there's such an incredible demand for healthcare services and fewer doctors, nurses, and other healthcare providers, that really the number one request that I have across the board from companies that want the Venture Studio to help them build companies, which is part of the mission of the Venture Studio, is to solve pain points by building companies that are requested from large pharma, biotech, and medtech to Endeavor. The number one problem right now is lack of physicians, nurses, and other trained healthcare personnel. Mm-hmm. And so until we solve that problem, you know, the economic pressures are going to continue, because there's just not enough provider power to solve this. So there needs to be some educational components to this. Other countries like Switzerland do have different philosophies. France has different philosophies about what is expected from the patient. And the educational system for physicians and other healthcare providers also needs to be adjusted. And while this is outside of your wheelhouse at the moment, I think ultimately it will begin to show up in how many tests are ordered, how many examinations are done virtually versus in person. And I think this could speak to, one of these issues where when you embed your, social impact component, which does have this psychological and emotional overlay, it may be very interesting to work with companies like Vertonomy. Vertonomy is a company that we had on BetterHealth a few weeks ago, and they look at ways of creating digital twin technology, virtual reality. So as patients go through the system, there may be educational tools that you can embed in your company, which are using virtual reality to bring a sense of comfort, understanding, and awareness.
Yeah, absolutely. I completely agree with that. And your point regarding staffing issues really doesn't end with the provider or the providers themselves, but also the back office staff. So healthcare provider organizations have been experiencing extreme turnover and staffing challenges with their back office staff as well. And that's something that RIVIA Health does help to alleviate also. And in terms of lowering the overall cost of operating the organization and providing care, we can make a very big impact from the back office side, because our software automates manual tasks related to the patient billing process. So we actually, for one 12-location urgent care group, we lowered their operating costs by $250,000 in just 1 year.
Fantastic. Well, we have a lot of comments from people who have dialed in, and I just want to take a moment to acknowledge, Chad, who is dialed in, talking about the documentation requirements, which are a huge burden for healthcare providers, mm-hmm. and Anita, who has called in, talking about the anxiety relating to medical bills. I think that some of the things that we've been talking about are resonating with our viewers, and certainly, patients understand firsthand that this is a chronic stress. This is not, something where you have a 2 or 3 or 4 day event, but this is something that's, week in and week out, and the bills can be quite large quite quickly. And so I think looking at alternative mechanisms to be able to finance that, to create win-win, ultimately there should be mechanisms within community organizations to recognize various cohorts and various communities and government organizations. And certainly we do have systems in place, which recognize this within, let's say, the Medicaid community or the Medicare community, depending on socioeconomic status or age. But it's not enough, and those systems within the next 20 years are going to be financially stressed, if not bankrupt, according to various organizations within the government. And I think companies like yours who are beginning to bring the private sector into this equation are critically important. So I would urge you, again, working with organizations like the Clinton Foundation that looks at global healthcare problems and speaking at the Clinton Global Initiative would be an awareness building event that lets people come to you and to, I think, the healthcare system with the same aligned vision and mission.
Yes, thank you. We would really appreciate that opportunity. And like you and I were talking offline, a lot of those organizations that there are safety nets in place, for example, for patients, a lot of the time patients just aren't aware of those safety nets, and technology can really help to make those more accessible to those who need them. So, for example, some of the things that we've been talking about at RIVIA Health are working with federally qualified healthcare organizations, FQHCs, that do offer sliding scale fee schedules for patients based on their economic need. And, that today is a very manual process.
Mm-hmm.
It's often very hard for patients to get visibility to the fact that that's available to them and then apply for it, have it processed. So one of our ideas is to work with some of our FQHC customers to automate that process and make that a solution that we can proactively notify patients of and make sure that if they need that they're aware that those solutions are available to them. Similarly, you mentioned, bills that add up over time. For a lot of patients that have reoccurring appointments like physical therapy, mental health and wellness visits, etc., they do end up having a lot of smaller bills that add up and become a larger balance. And what RIVIA Health has done is recently we've just launched a new payment plan functionality on our side that enables patients to roll multiple balances up into one payment plan, which can really help to alleviate that pain as well. So I think that technology can help alleviate some of these both patient and provider pain points that exist.
I just want to briefly acknowledge Chad, who, shared with us a heartfelt personal statement. And he just really directed this to you, Rachel, saying, Rachel, as a caregiver to chronically sick family members, thank you for your hard work in this aspect of healthcare. So you have the support of listeners. I hope that it continues to empower you, and your partner. I know that, in fact, your partner was supposed to be here today, your co-founder, but she herself was not feeling well. So I certainly hope that she has a chance to come on the show and tell us as your company begins to grow and scale. And I know that you're actively looking to that process, over the next several weeks, even. Bring us up to date in the future about how patients, healthcare providers, and your company are working in this community setting. And as you roll out your social impact initiative, that's going to be very exciting to hear more about that as well.
Absolutely. We would be happy to return, and I'm sure Elizabeth would. I know she would add a lot of value, and I'm sure she would be happy to join as well.
Yeah. And now I think let's take a look in your crystal ball. What do you see, let's say 3 to 5 years down the road? You're doing things as an early stage company. First, tell us a little bit, what is it like to be a woman entrepreneur? I mean, this is a very important part of what Endeavor does. We do support women entrepreneurs, entrepreneurs of color, entrepreneurs in disenfranchised communities. One of the things that we're proud of is working with Clinical Trial Hero, which is a company that does support enrolling and accelerating enrollment of disenfranchised patients in clinical trials to allow them access to first-tier, high-level, novel new drugs. So I'd like you to talk a little bit about, your crystal ball and where you see, what you're doing, and what you see in the field in general, where you're at in terms of the economic side, and how that's going to change perhaps with technology over the next 3 to 5 years.
Yeah, absolutely. I think that Elizabeth and I have a vision for the company where we would like RIVIA Health to be the best solution and the go-to solution for physician group organizations in the US when it comes to managing and facilitating patient responsibility recognition, and also on the patient side, there, as a result, making it easier for patients to get visibility to understand and pay their bills and get access to safer financing options. So our vision is to be the primary solution and kind of the default best option for specifically physician group organizations. And we've been building our platform in a way that is configurable for different specialty practice needs and workflows, so that we can easily go live with a specialty practice group and configure the workflows to fit their exact needs, and therefore automate all of those back office activities for their staff, so that their staff can spend more time with patients and spend more time on higher value activities. So that's really our long-term vision and mission. And I think from a social impact standpoint, we want to make a dent in the medical debt problem in America and the number of bankruptcies that represent medical debt. So that's really core to our mission as well. So I think if we can look back 10 years later and say we've built a solution that now patients can alleviate patient stress, and it makes it easier for patients to manage all of these things and avoid using credit cards to pay for medical bills, and also can avoid patients being sent to collections, then we'll feel like we've won and we've succeeded with our mission.
No, that's fantastic. I think the things that I'm seeing in technology are really outstanding, and part of what we're focused in on is creating a sense of comfort, within patient communities, whether that is building trust within disenfranchised communities to engage them and enroll them in clinical trials, or trust within the billing process. It's not really the fault of the patient that healthcare is so costly, but it unfortunately is the responsibility. So within this frame of responsibility, almost everyone, as you pointed out earlier, wants to be responsible, but the fear of the unknown, the confusion of multiple bills, multiple offices, rebilling, co-pays, out of pocket, deductibles, even as a physician, it is insurmountable. So I think one of the key things to focus in is on simplification. Simplification of the entire system is something that technology can do. And I know that you are addressing that. So perhaps, we can talk a little bit about that.
Yeah, absolutely. And I think that too, the visibility ahead of time is important as well. And I know in our industry, there's a big emphasis on the transparency, price transparency prior to a procedure or a patient treatment. And I think that's something that a lot of great technology companies are working on. And we have an eye to fit into that workflow and support that as well. And so I think the more we can provide patients with visibility to a patient estimated balance, for example, leading up to a surgery, and then give them a payment plan option that they can make installments on pre-surgery and post-surgery over time, that's going to really empower the patient to better manage their finances and evaluate what they can afford and the decisions that they're making. I think there are some other companies too that are looking at the shop around model. And, that's not an area where we play, but especially for patients that are looking at the self-pay option, I think some of those shop around tools that are being developed right now, once they're, in full-fledged capability, which I think it's still a nascent stage, but I think those will be very helpful as well, so that at least patients can compare one surgeon to another and understand what their core fee schedule is. The challenge right now is that, every provider has their own fee schedule with every single insurance organization. And so that can be a very complicated process to get accurate price transparency to the patient as a result. However, it is a very active nascent space in our industry that a lot of different technology companies are working on solving, and some have some initial solutions that work very well for more standard procedures like lab tests, standard copays, well visits. And our software is already starting to integrate that workflow into our process, where we can let a patient know ahead of time, here's your super maternity bill estimation, and you can set up a payment plan and start making payments over the course of your pregnancy and post-delivery, so that the patient isn't surprised post-delivery, getting a $20,000 medical bill in the mail when they're nursing their infant that they now have to figure out how to finance.
So we just got a comment from one of the viewers, Kate, that organizations are implementing just what you talked about. She mentions, for example, LabCorp in estimating responsibility for lab bills, which I think is a great focus on communication. So the barriers that exist between healthcare providers, laboratories, and other organizations and patients rests upon awareness and communication. And I see that you can act as a tool in that, as part of your social impact and awareness program. So I'm looking forward to better understanding how that is perceived. I would imagine you're going to have some type of feedback, both from the healthcare providers, corporations, and from patients, most importantly. At our organization, we constantly look for this give and take of information from our portfolio companies, to the people that are using the services. And that allows us to adapt and pivot and grow, rinse and repeat. So that process of communication and hearing, what's on the other side of the table is absolutely critical in billing. Small little differences, make a really big psychological impact. I'm sure that you can attest to that. And, the notion that women are controlling a lot of the finances in terms of how these bills are paid. I know that there are many organizations that you can partner with that will allow you to integrate, some of these, let's say, the strengths that come from leadership within the community of women who are responsible for these bills. And that would be an exciting next kind of step to see how that pans out.
Yes, absolutely. I think there are more and more companies that are dedicated to addressing financial health and physical wellness specifically for women in America. And we've been looking at partnering with a few of them as well on this mission.
One of the companies that we highlighted earlier, KindBody, in the fall, is just in a spot-on indication of how women can come together. OBGYN and endocrinology physicians, led by a fantastic group of women who have really identified a pain point within women's health, in vitro fertilization in particular. And we showcased them, back in October in partnership with Harvard Business School and Capgemini, looking at how the company can move itself into a position of respect and authority within the women's communities who need their help. And, fortunately, they've gotten tremendous recognition since that symposium. $100 million check has been written by Google to help finance them. They've formed partnerships now with Walmart so that the in vitro fertilization and women's health services can be provided to Walmart employees. And those are the kind of things that I speak to this important new transition of which you're a part, which is leadership in entrepreneurial ventures is now being met with leadership at the corporate level. And I just see that as a space where your company can certainly find an incredible partner in companies like Walmart, where there are places, that show empathy and understanding of the difficulties in this process. And I speak for myself as well as Endeavor, just wishing you and your partner just all the success in the world. And we, as a company and myself personally, are here to help in that process.
Thank you so much. I really appreciate your support, and thank you for having me on the webinar today.
It's been my absolute pleasure. We got a lot of thank yous. Kate says thank you. Chad, Anita, Martin, so many people have signed in from so many places. I really want to thank again, the members and the audience at BetterHealth. It's been a fantastic journey so far. We're going to continue to bring amazing companies to you. Please stay tuned. Next week, we have an exciting company that is using technology and cloud-based programs to look at congestive heart failure and how we can look at minimizing the rebound when patients leave hospital, go home, and then unfortunately decompensate and go back into the hospital. Using advanced technologies, this company is really doing things that are so critical to saving people's lives and improving the healthcare economics of congestive heart failure. So Rachel, thank you. A shout out to Elizabeth. I hope you feel better. And a shout out to everyone who's watching here, that I know that RIVIA, would welcome any collaboration partnerships as they move their company forward in this incredible journey to help patients and healthcare providers at large.
Absolutely. Thank you so much.
Have a wonderful afternoon, everyone. I look forward to seeing you next Tuesday at noon. Rachel, stay on the line for just a moment.
Great.
Take care, everyone.